So, in restless leg syndrome with dopamine agonist augmentation, how can the elimination of the dopamine agonist drug lead to depressed mood symptoms? I'm Dr. Andy Berkowski of ReLACS Health, and today I want to talk about one of the more concerning observations I've made with taking people off of dopamine agonists after augmentation. It really gets down to the damage to the natural dopamine system from dopamine agonist medications. Now, please remember that in restless leg syndrome, there is some dysfunction of the dopamine system, and dopamine agonists used to be a viable treatment option, in fact, a first-line treatment option for restless leg syndrome. Unfortunately, it's been shown over 20 years of use that over time augmentation develops where the dopamine system gets disrupted and the brain gets conditioned to being on these dopamine drugs, leading to a chemical dependence. So the drugs start to make the condition worse, and over time, it's very difficult to get off the drug because of the dependence of the brain on the drug. This can lead to effects on the dopamine system aside from restless leg syndrome, including abnormal limb movements, but also impulse control disorders, which I've discussed elsewhere. And that's due to the dopamine system being influential in mood, behaviors, and movements, in addition to sensations, as in restless leg syndrome. So just like too much of the dopamine agonist medications can cause impulse control problems, the opposite can occur when coming off the dopamine agonist medication. Most restless leg specialists do a long taper of patients off these drugs, usually over the course of weeks to months. However, drug companies don't study what happens when you go off their drug. They only study what happens when you take their drug. And one of the understated problems of these dopamine agonists are the lack of dopamine input once a patient is off the medications. Patients often report that they feel their restless legs is much better, they are sleeping much better, but they don't enjoy life quite as much. I've now seen a lot of cases of depression developing long after discontinuation of the dopamine agonist medication. Some patients have even become suicidal. This is very worrisome and another reason why no one should be prescribing dopamine agonists for restless leg syndrome, even though they are still being prescribed to the tune of 70% as it stands the past few years. So what can be done about this? Well, there are no studies as to what to do. You could replace the dopamine by giving the drug back and reversing the process, but that's just delaying the inevitable and kind of reversing back to where you came from before with more augmentation and more impulse control problems. So it has to be handled without the use of dopamine, and this involves all of the other features that help with mood, including social engagement, getting out, doing things that are pleasurable but may not seem pleasurable. Remember, the dopamine agonists screw up this dopamine system where things that normally would be rewarding are no longer pleasurable. Think of kids eating candy. They get super excited when they think about the thought of you giving them candy. Well, that's the dopamine system priming them to enjoy the taste of the candy rushing into their brain. Well, what if they didn't get excited about it? They would be like, oh, great, this is candy, it's sweet, who cares? And that's kind of what happens in the brain. Things that normally produce anticipation of pleasure are no longer pleasurable. So social engagement is a good idea. Doing activities that bring about pleasure to help stimulate that could be a good idea. Therapy, seeing a therapist once a week to work through these symptoms of mood, that sounds like that would be a good idea. And then there are, of course, medication treatments for depression, including bupropion, or the brand name Wellbutrin, which is neutral towards restless leg syndrome. And then, of course, there are all sorts of antidepressants like SSRIs and SNRIs, these classes of drugs that are typically used for depression. They may worsen restless leg syndrome just a little bit, but hopefully the provider can work their way around that with other treatments to compensate if there is an increase in restless leg syndrome. But the most important thing is for patients and doctors to be looking out for depressive symptoms after discontinuation of dopamine agonists for augmentation, and really to gauge proactively patients who are reporting these symptoms. We call it anhedonia, but a lack of enjoyment in things that normally should be enjoyable. And of course, this video is for general medical information only. It does not constitute the practice of medicine. These medical decisions should be made under the supervision of a licensed medical provider. And as always, one of the keys to sleeping well is to relax.